Hello, welcome to the latest ACE research review, and today we're looking at should I lift heavy or light for size and strength? We should remind ourselves why strength is important, or in other words, why bother. And note that grip strength, a powerful predictor of health, was linked to 69% higher risk of premature death in healthy Americans. So grip strength certainly isn't just about how firmly you can shake someone's hand. It is a pretty powerful indicator on your overall health and certainly your overall strength. So low strength is associated with high risk of heart disease, increased likelihood of morbidity issues, lower mobility, and earlier mortality. So in other words, strength is really, really important for your health. And not allowing oneself to become weak as we age is a really important health outcome to pursue and an important goal. So the paper of interest from Curier and colleagues looked at a very common question in resistance training. Do I need to lift heavy or can I train with lighter weights and still achieve these important health gains in strength? They also looked at hypertrophy, but we'll focus on strength. So this has important implications in both rehabilitation and certainly in longevity and health span. Certainly, this particular study wasn't a single design study where they ran an intervention and we just report on that. There's actually a systematic review and meta-analysis, which is a very powerful form of research. What this means is they looked at hundreds of randomized controlled trials. So these are high quality individual studies that they selected. And they were looking at the types of resistance training these people did and across all of these studies. What's really interesting and important about this paper is they looked at these critical combinations in the acute training variables, which is heavy versus light, single versus multiple sets, and then how many times a week you should train. And they actually compared them against each other. And because there were so many trials, they used a method called network meta-analysis. So this allowed them not only to compare the programs directly tested in the same study, but they also then connected the dots between studies that have never actually been compared to each other. I.e., is it better to do one set or multiple sets, train once, or try and train 3 times a week? So that's super important. But in simple terms, this study design gives us a very strong overall picture of what kind of resistance training or strength training or weight training works best when we're trying to improve strength. And that's what we really want to know. Now, in this paper, there's a very important figure that we should look at. And it does look complicated, but we'll break it down. On the left side, we're focusing on just left side, which is strength. If the dot is to the right of the middle, it means the program worked better than nothing. So obviously, the further away the dot is from this zero line, the stronger and greater the effect. Okay, that's important to note. Then we'll break down the abbreviations so we know what we're looking at. First letter is either high or low load. So L means low load, less than 80% of 1 RM. H down here is high load, greater than 80% of 1 RM. So that's, heavier weight. Second one is how many sets. Say they did a single set, S for single or M for multiple sets. And the last one is how many times a week, 1, 2, or 3 times a week. So we understand that. So if you see HM2, it means high load, multiple sets twice a week. High load, multiple sets twice a week. Now, the really interesting finding is this. What it shows is, of course, if you train with heavier weights and do multiple sets, you see the dot is further to the right, okay? And we can see I picked the one in green here representing high load, multiple sets 3 times a week. And we can see that that dot's furthest to the right, and that's the strongest improvement. Okay, we'd probably expect that. But what's important to note is lighter weight, multiple sets 3 times a week isn't much different. You can look at this. The difference is barely 1 point. Okay, so it really highlights that light training can or is effective and it builds strength in healthy populations. Okay, so light training is much more effective than doing nothing, and it isn't as effective as training with heavy weights. However, it's not far off, and it's probably going to do the job to get most people into a healthy range of strength. That's the important take home. Otherwise, all loads build strength, but to really move the needle, and at some point, people who really want to maximize their strength, of course, we should advocate for heavier weights more times a week. That hasn't changed. But what's really unique about this study and the take home is light weights will get the job done. So it's time to revisit the traditional view. This continuum, which still is in textbooks to this day, tells us that strength here gets maximized with heavier weights and lower repetitions. And we don't see anything for strength that it tapers off the further down you go in terms of more reps and lighter weight. Okay. Now, another point to make, and this paper was published in 2018, the paper we're looking at today from Curier and his colleagues was published in 2023. So at this time, this paper, and this is a really famous and often cited infographic and study from Schulman colleagues, which Jan Lamore's done a great job in synthesizing. And in this graph, you'll see something like bodyweight exercise only gets point for improving strength, and there's 5 points for eccentric training. What we should take out of this new knowledge is that if that bodyweight training is done to fatigue, and this is the key caveat, you will build strength. So it's time to rethink about this advice about exercise selection or training modality selection, and that the type of training, whether it's body weight, machine based, just looking at these lower ones, unilateral exercise, can all build strength on this new finding. These are as long as we achieve a few things. And the main caveat is with lighter loads and higher reps, you still have to create fatigue. So if they're not getting to the end of the set and saying I could probably do two more, the classic two RIR, reps in reserve, they're not reaching that minimal threshold for fatigue. Of course, it's not going to build strength. But if they are, then some of these modalities have the potential to be equally effective in our healthy populations, and we should reconsider that. So even Stuart Phillips, the guru in all things muscle physiology, is saying the old non-evidence-based strength endurance continuum needs to change. Look at the new continuum that he believes needs to be republished. We've got strength along the whole way of the continuum, and its strength can be built with heavier weights or lighter weights. So the takeaway, one, use a range of rep schemes. Two, for strength, lighter loads will build strength in healthy populations. So if they can't access heavy weights, aka they don't want to go to a gym or they can't access the gym where the heavy weights are, they can do home-based training interventions with lighter loads and still build strength. All resistance training programs increase strength. Healthy adults can adopt any program of their choice and preference. At the end of the day, if they're not going to stick with something, what's the point? So if they're more likely to stick with a bodyweight program, they can do it at park, say, then great, promote it. Give them the key acute training variables, make sure that they're taking those sets to a requisite level of fatigue, and off they go. All resistance training programs are better than no exercise. We saw that. So even programs with single sets are better than no. So if they don't have time, and we spoke about minimal dose prescription on an earlier research review, then we can go back to those minimal dose guidelines to get people started and moving the needle in the right direction. But an important caveat is that these findings still state that if the goal is to maximize strength, then the prioritization of heavy loads will always be the winner. So that finishes our review for this time. Feel free to contact me if you've got any questions.